Welcome to the Heartbeat Podcast, your trusted source for the latest breakthroughs and insights in cardiology. Here, we uncover the science behind every beat, bringing you cutting-edge research, expert discussions, and innovative approaches to heart health. Whether you're a medical professional, a curious learner, or someone passionate about understanding the heart's complexities, you're in the right place. So let's dive into today's episode and explore the pulse of modern cardiology together.
All right, buckle up, everybody, because we're going deep on some brand new research on tirzepatide and how it could be a total game changer.
Huge.
For heart failure.
Yeah.
Specifically the kind with preserved ejection fraction.
Right.
We're doing this one just for you because you mentioned you were really interested in how this new research might affect your own health journey. So
For sure.
Let's jump right in.
Absolutely. So
what makes this deep dive particularly timely is that the study we're looking at was just published a few days ago.
Very recently.
In the New England Journal of Medicine.
That's right. One of the most prestigious journals out there. So
Oh, yeah, for sure.
when it's an NEJM, the research has been really thoroughly vetted.
Yeah. The SUMMIT trial is making waves, and for good reason.
Absolutely.
Before we get into the nitty-gritty, though, I think we should probably start with a little heart failure 101.
Okay.
For our listeners. What exactly are we talking about when we say heart failure with preserved ejection fraction?
Well, you can think of your heart like a pump with two main actions.
Okay.
Squeezing to pump blood out and relaxing to refill with blood.
Gotcha.
With heart failure, with preserved ejection fraction, or HFpEF.
HFpEF.
The problem is that the heart doesn't relax properly.
Okay.
It's like trying to fill a water balloon that's already kind of stiff.
Interesting.
It doesn't expand as easily, making it harder for the heart to fill up with blood between beats.
Okay, so the pump's not broken, it's just stiff.
Exactly.
And I know this type of heart failure is particularly common in people with obesity, right?
Yes.
Yeah.
And a key player in this whole scenario is something called visceral adiposity, which is basically the fat that surrounds your organs.
So not all fat is created equal.
Exactly. Visceral fat is the troublemaker here.
Interesting.
It releases inflammatory substances that affect the heart and blood vessels, making that stiffness even worse.
Yeah.
And leading to a whole cascade of problems.
It's like a domino effect, more fat, more inflammation, more strain on the heart, and ultimately worsening heart failure.
Right. It's a vicious cycle.
So where does tirzepatide come into all of this?
Okay.
I know it's a medication already being used for weight loss.
That's right.
How could it possibly help with heart failure?
Well, tirzepatide works by mimicking two hormones in your body.
Okay.
GLP-1 and GIP.
Okay.
They're like messengers that tell your brain you're full.
Okay.
Helping you eat less.
Gotcha.
They also help regulate your blood sugar levels.
Okay.
Tirzepatide basically turns up the volume on these signals, leading to pretty impressive weight loss.
Yeah.
Often in the range of 12 to 21% for people with obesity.
So we've got this drug that helps people lose a significant amount of weight.
Right.
And we know that obesity is a major risk factor for HFpEF. The SUMMIT trial wanted to see if tirzepatide could actually improve outcomes for people already living with this condition.
Precisely. And this wasn't a small study.
Right.
They enrolled over 700 participants from 129 centers in 9 countries.
Wow.
Making it a truly global effort.
That's right. It was a really big deal.
It was.
With participants randomly assigned to receive either tirzepatide or a placebo, along with their usual heart failure medications.
Yeah.
And here's something that stood out to me.
Right.
The trial didn't require participants to have super high levels of certain blood markers, like NT-proBNP, which is often used to diagnose and monitor heart failure.
You've hit on a really crucial point.
Okay.
Many previous studies focused on people with more severe HFpEF.
Okay.
But the SUMMIT trial included people with a wider range of disease severity.
Gotcha.
This means the findings are potentially relevant to a much larger group of people living with this condition.
And potentially including our listeners.
Exactly.
So they set up this huge global trial, got all these participants, and started them on either tirzepatide or a placebo. What were they looking for?
Okay.
What were the goals of the study?
They had 2 primary endpoints.
Okay.
Which is just a fancy way of saying main goals.
Right.
First, they wanted to see if tirzepatide could reduce the risk of dying from cardiovascular causes or having a worsening heart failure event.
Okay.
Second, they wanted to know if it could improve patients' overall quality of life.
So did it. Were they able to hit those goals?
The short answer is yes.
Okay.
And the results were pretty impressive. They were.
Okay. Spill the beans.
Yeah.
What kind of impressive are we talking about here?
Well, let's start with that first goal of reducing cardiovascular deaths.
Right.
Or worsening heart failure.
Okay.
The trial found that people taking tirzepatide had a 38% lower risk.
Wow.
Of experiencing one of these events compared to the placebo group.
38%.
Yeah.
So for every 10 people in the placebo group who had a serious heart problem, only about 6 people in the tirzepatide group did. That's huge.
Yeah.
It sounds like tirzepatide is really making a difference.
It really is. And when you look at the risk of heart failure getting worse, specifically, the numbers are even better.
Oh, wow.
The tirzepatide group had a 46% lower risk.
Wow.
Compared to placebo.
That's remarkable.
Yeah.
But what about quality of life?
Yeah.
How did they even measure something like that?
That's a great question.
Yeah.
They used a special questionnaire called the Kansas City Cardiomyopathy Questionnaire.
Okay.
It asks about things like symptoms, physical limitations, and how heart failure impacts daily life.
Gotcha.
The higher the score, the better the quality of life.
So did tirzepatide actually boost those scores?
Absolutely.
Really?
The tirzepatide group saw their scores jump up by almost 20 points.
Wow.
While the placebo group only improved by about 13.
Okay.
That's a really meaningful difference.
So not only did tirzepatide help prevent serious heart problems, but it also helped people feel better in their daily lives.
Yeah.
I bet that gave them a new lease on life.
For sure.
We also talk about those secondary endpoints the study looked at.
Yeah.
Things like weight loss.
Right.
How far people could walk. And inflammation levels.
Yeah.
I have a feeling those results were pretty interesting too, right?
You're right on the money.
Okay.
The differences between the tirzepatide group and the placebo group on these secondary endpoints were really striking.
Okay. I'm on the edge of my seat.
Okay.
Give me the highlights.
First up, weight loss.
Okay.
The average weight loss in the tirzepatide group was almost 14%.
Okay.
Compared to a measly 2% in the placebo group.
Whoa, that's not just losing a few pounds.
Right.
We're talking about a significant change in body composition.
Absolutely.
And what about the walking test?
Remember the 6-minute walk test? Measures how far someone can walk in, 6 minutes?
Right.
It's a simple way to assess overall fitness and endurance. The tirzepatide group was able to walk an average of 26 meters further than the placebo group.
That's like being able to walk an extra half a basketball court.
Wow. Yeah.
Imagine being able to keep up with your grandkids or climb a flight of stairs without getting completely winded.
Yeah.
That kind of improvement can make a real difference in someone's life.
Exactly. These aren't just numbers on a page.
Right.
They represent tangible improvements in people's daily lives.
And what about inflammation?
Yes.
We talked about how that visceral fat triggers a whole cascade of inflammation that contributes to HFpEF.
Right.
Did tirzepatide help calm things down?
It did.
Okay.
The study measured a marker of inflammation called CRP.
Okay.
The tirzepatide group saw their CRP levels plummet.
Wow.
By nearly 39%.
Wow.
Compared to a tiny 6% reduction in the placebo group.
Wow. That's a dramatic difference.
It is.
So tirzepatide seems to be hitting the problem from all sides.
Yeah.
Helping people lose weight, improving their ability to exercise, and reducing harmful inflammation.
Right.
It sounds almost too good to be true.
It does.
I'm sure our listeners wondering about potential downsides too. What about side effects?
Sure.
Any red flags there?
It's important to address that.
Yeah.
No medication is completely without risk.
Right.
The most common side effects in the tirzepatide group were gastrointestinal. Things like nausea, vomiting, and diarrhea.
Yeah, those are never fun.
No, they're not.
But were they severe enough to make people stop taking the medication?
Thankfully, these side effects usually faded over time.
Okay.
As people continued treatment.
Gotcha.
Only about 4% of the people taking tirzepatide stopped because of these issues.
Okay, so a little rough in the beginning, but usually manageable.
Right.
What about any serious side effects?
Sure.
Anything concerning there?
Importantly, serious side effects were rare.
Okay.
And happened about as often in both the tirzepatide and placebo groups.
Okay.
This suggests tirzepatide is generally safe.
That's reassuring to hear.
Yeah, it is.
Okay, we've covered a lot of ground.
We have.
The study designed the primary goals.
Yeah.
Those secondary measures, and even side effects.
Yeah.
What are the key takeaways our listeners should walk away with?
The Obesity trial offers a lot of hope for people with HFpEF and obesity.
Absolutely.
Tirzepatide didn't just reduce the risk of dying or having heart failure get worse,
Right.
but it also significantly improved quality of life for these patients.
Right. We're talking about people feeling better, being able to do more, and having less inflammation.
Yes.
These are real tangible improvements.
They are.
What's really fascinating to me is just how effective tirzepatide seems to be.
Right.
Is it purely the weight loss that's driving these benefits? Or are there other mechanisms at play that we're just beginning to understand?
Yeah, that's a great question.
It really is, and one that researchers are actively investigating.
Right. It's likely a combination of factors.
Yeah.
The weight loss itself certainly plays a big role.
For sure.
But tirzepatide also seems to have direct effects on the heart,
Oh, yeah.
reducing inflammation and improving its function.
It's like we're seeing a whole new chapter unfold in the fight against heart failure.
It is. It's a chapter filled with possibilities.
Wow.
It's not just about managing symptoms anymore.
Right.
It's about tackling the underlying drivers of the disease.
This SUMMITE trial feels like a turning point for HFpEF treatment.
It does.
It offers hope for people who previously had very limited options.
I agree. And remember, this is just the beginning.
Right.
There's so much more to learn about tirzepatide and its potential.
So where do we go from here? What are the next steps for someone like our listener who wants to learn more about tirzepatide and whether it might be right for them?
The most important next step is to talk to your doctor.
Okay.
They can help you understand how this research applies to your individual situation.
Yeah.
Considering your medical history, current medications, and overall health goals.
That personalized conversation is key.
It is.
Every health journey is unique.
For sure.
And your doctor can provide tailored guidance based on your specific needs.
Exactly. Knowledge is power.
Right.
Especially when it comes to your health.
Yeah.
So don't be afraid to ask questions and advocate for yourself.
Well said. This is a lot to digest.
It is.
And I'm sure our listener has a lot to think about.
Yeah.
What's one key question they should consider as they continue their own deep dive into this topic?
As you reflect on what we've discussed today,
Okay.
ask yourself, how might this new research on tirzepatide and HFpEF shape your own approach to managing your health?
Interesting.
What new possibilities does it open up?
Yeah.
And how might it empower you to have more informed conversations with your healthcare providers?
Right.
This deep dive is just the starting point. Your own exploration and understanding will ultimately guide your path towards better health and well-being.
It's like we've given our listener a flashlight to illuminate a path they can now explore further with their doctor. We've provided the information, but ultimately the power to make informed decisions about your health lies within you.
That's a great way to put it.
And on that note, we'll wrap up this deep dive into the groundbreaking SUMMITE trial and its potential implications for the future of HFpEF treatment.
Great topic.
Thanks for joining us. Until next time, keep exploring, keep learning.
Thank you for tuning into the Heartbeat Podcast, where we uncover the science behind every beat. If you enjoyed this episode, don't forget to subscribe to the podcast on your favorite platform to stay updated with our latest discussions and insights. We'd love to hear from you. Share your thoughts, feedback, or questions, and let's continue exploring the pulse of modern cardiology together. Until next time, take care, stay curious, and keep your heart healthy.